There is this common nursing school interview that a lot of candidates failed recently. And the question goes, what will you do if you saw a fellow nursing student cheating? Now, a seminar asked this question to know if you understand the impact of cheating in nursing profession. All right. Now, how do you answer this question? There is a structure for you to follow for you to answer this question correctly. First of all, you have to acknowledge the seriousness of the situation. How do you do that? Let your examiner or your interviewer knows that you understand the impact of cheating in the nursing profession. So, for example, you can say something like, cheating is a serious matter in the nursing profession because it compromises with the integrity of the nursing education and could potentially affect the quality of care we provide as future nurses. So now with this first response, your examiner will calm down and look at you with a high sense of maturity, knowing that you really understand what nursing is all about. Now the next structure or the next point for you to follow is tell your examiner that you assess the situation because you have to assess the situation to be sure that that what you saw is actually true. So now the second point is that you have to assess the situation to be sure that what you saw is actually true. You want to confirm that what you saw is actually true because you don't want the situation if you reported your colleague and they after they carry out investigation and they realize that, oh, the information you gave wasn't true. You may be punished in that process. So you have to assess the situation. If possible, you approach the individual and make sure that it was not a minor error or that this thing was actually done intentionally. For example, if you catch your colleague documenting or charting vital signs without actually checking the patient's vital signs, and you approach your patient or your colleague rather to let her know that you saw what happened, that she did not check but she chatted. If she responded well and corrected her mistakes, then that is the end of it. But if she challenged you or tried to defend it, then you know that the patient health is at risk. Then